Ehlers Danlos syndrome is an inherited connective tissue disorder with different presentations that have been classified into several primary types. EDS is caused by a defect in the structure, production, or processing of collagen or proteins that interact with collagen, such as mutations in the COL5A or COL3A genes. This is the collagen of granulation tissue, and is produced quickly by young fibroblasts before the tougher type I collagen is synthesized. Reticular fiber. Also found in artery walls, skin, intestines and the uterus. COL3A1. The collagen in connective tissue helps tissues resist deformation. Collagen is an important contributor to the physical strength of skin, joints, muscles, ligaments, blood vessels and visceral organs. Abnormal collagen renders these structures more elastic. Depending on the individual, the severity of the mutation can be life-threatening. There is no cure, and treatment is supportive, including close monitoring of the digestive, excretory and particularly the cardiovascular systems. Occupational and physical therapy, bracing, and corrective surgery may help with the frequent injuries and pain that tend to develop in certain types of EDS, although extra caution and special practices are advised to prevent permanent damage. The features of EDS were first described by Hippocrates in 400 BC. The syndrome is named after two physicians, Edvard Ehlers from Denmark, and Henri Alexander Danlos from France, who described it at the turn of the 20th century. Classification. In the past, there were 10 recognized types of Ehlers Danlos syndrome. In 1997, researchers proposed a simpler classification that reduced the number of major types to 6 and gave them descriptive names. These 6 major types are listed here. Other types of the condition may exist, but they have been reported only in single families or are not well characterized. Except for hypermobility, some of the specific mutations involved have been identified and they can be precisely identified by genetic testing. This is valuable due to a great deal of variation in individual cases. However, negative genetic test results do not rule out the diagnosis, since not all of the mutations have been discovered. Therefore the clinical presentation is very important. Although the following classifications are well defined, it is rare for a case to fit neatly in a single category, and crossover symptoms lead to underdiagnosis or misdiagnosis. Therefore, patients should not rely on the fact of having a certain type of EDS if crossover symptoms are evident because of possibly life-threatening symptoms. For example, it is possible for an individual with classical EDS to exhibit symptoms of hypermobility or vascular EDS. In order of prevalence in the population, the classifications are: overall, research statistics of EDS show the prevalence as 1 in 2,500 to 1 in 5,000 people. Recent clinical experience suggests that this condition goes underdiagnosed and the condition is more common than these ratios indicate. Other types, forms of EDS within this category may present with soft, mildly stretchable skin, shortened bones, chronic diarrhea, joint hypermobility and dislocation, bladder rupture, or poor wound healing. Inheritance patterns within this group include X-linked recessive, autosomal dominant, and autosomal recessive. Examples of types of related syndromes other than those above reported in the medical literature include 305,200 a Eurotype 5, 130,080 a Eurotype 8 a Euro unspecified gene, locus 12p13, 225,310 a Eurotype 10 a Euro unspecified gene, locus 2q34. 608,763 a Euro Beasley a Euro Cohen type, 130,070 a Euro progeroid form a Euro before Galt 7, 606,408. A Euro due to tenacin X deficiency a Euro TNXB, 130,090 a Euro type unspecified, 601,776 a Euro D4ST1 deficient Ehlers Danlos syndrome CHST14, signs and symptoms. Signs vary widely based on which type of EDS the patient has. In each case, however, the signs are ultimately due to faulty or reduced amounts of collagen. EDS typically affects the joints, skin, and blood vessels. Following is a list of major signs and symptoms. Musculoskeletal, hyperflexible joints, unstable joints that are prone to sprain, dislocation, subluxation and hyperextension, early onset of advanced osteoarthritis, chronic degenerative joint disease, swan neck deformity of the fingers, boutonniere deformity of the fingers, tearing of tendons or muscles, deformities of the spine, such as scoliosis, kyphosis, tethered spinal cord syndrome, occipito-atlantoaxial hypermobility, myalgia and arthralgia, which may be severe, Trendelenburg's sign, Osgood-Schlatter disease, skin, fragile skin that tears easily, easy bruising, redundant skin folds, mollussoid pseudotumors, especially on pressure points, subcutaneous spheroids, levator reticularis, cardiovascular, arterial rupture, valvular heart disease, dilation and/or rupture of ascending aorta. Postural orthostatic tachycardia syndrome, Raynaud's phenomenon, other manifestations or complications, hiatal hernia, anal prolapse, collapsed lung, nerve compression disorders, insensitivity to local anesthetics. Arnoldo-Chiari malformation, platelet aggregation failure, pregnancy complications, increased pain, mild to moderate peripartum bleeding, cervical insufficiency, uterine tearing, or premature rupture of membranes. Sleep apnea, because it is often undiagnosed or misdiagnosed in childhood, some instances of Ehlers Danlos syndrome have been mischaracterized as child abuse. The pain associated with this condition is a serious complication. Genetics, mutations in the following can cause Ehlers Danlos syndrome: fibrous proteins, COL1A1, COL1A2, COL3A1, COL5A1, COL5A2, and TNXB, enzymes, ADAMTS2, PLOD1, B4 GALT7, mutations in these genes usually alter the structure, production, or processing of collagen or proteins that interact with collagen. Collagen provides structure and strength to connective tissue throughout the body. A defect in collagen can weaken connective tissue in the skin, bones, blood vessels, and organs, resulting in the features of the disorder. Inheritance patterns depend on the type of Ehlers Danlos syndrome. Most forms of the condition are inherited in an autosomal dominant pattern, which means only one of the two copies of the gene in question must be altered to cause the disorder. The minority are inherited in an autosomal recessive pattern, which means both copies of the gene must be altered for a person to be affected by the condition. It can also be an individual mutation. Please refer to the summary for each type of Ehlers Danlos syndrome for a discussion of its inheritance pattern. Diagnosis. A diagnosis can be made by an evaluation of medical history and clinical observation. The Baton criteria are widely used to assess the degree of joint hypermobility. Both DNA and biochemical studies can be used to help identify affected individuals. Diagnostic tests include collagen gene mutation testing, collagen typing via skin biopsy, echocardiogram, and lysyl hydroxylase or oxidase activity. However, these tests are not able to confirm all cases, especially in instances of an unmapped mutation, and so clinical evaluation by a geneticist remains essential. If there are multiple affected individuals in a family, it may be possible to perform prenatal diagnosis using a DNA information technique known as a linkage study. Differential diagnosis. There are several disorders that share some characteristics with Ehlers Danlos syndrome. For example, in cutis laxa the skin is loose, hanging, and wrinkled. In EDS, the skin can be pulled away from the body but is elastic and returns to normal when let go. In Marfan syndrome, the joints are very mobile and similar cardiovascular complications occur. People with EDS tend to have a Marfanoid appearance. However, it is important to note that physical appearance and features in several types of Ehlers Danlos syndrome also have characteristics including short stature, large eyes, and the appearance of a small mouth and/or chin, due to a small palate. The palate can also have a high arch, causing dental crowding. Blood vessels can sometimes be easily seen through translucent skin, especially on the chest. In the past, Menkes disease, a copper metabolism disorder, was thought to be a form of Ehlers Danlos syndrome. It is not uncommon for patients to be misdiagnosed with fibromyalgia, bleeding disorders or a variety of other disorders that can mimic EDS symptoms before a correct diagnosis is made. Because of these similar disorders, and complications that can arise from an unmonitored case of EDS, a correct diagnosis is very important. Pseudoxanthoma elasticum is worth consideration in diagnosing a patient. Management: there is no cure for Ehlers Danlos syndrome. Treatment is palliative. Close monitoring of the cardiovascular system, physiotherapy, occupational therapy, and orthopedic instruments may be helpful. Orthopedic instruments are helpful for the prevention of further joint damage, especially for long distances, although it is advised that individuals not become dependent on them until there are no other options for mobility. One should avoid activities that cause the joint to lock or overextend. A physician may prescribe casting to stabilize joints. Physicians may refer a patient to an orthotist for orthotic treatment. Physicians may also consult a physical and/or occupational therapist to help strengthen muscles and to teach people how to properly use and preserve their joints. There are different types of physiotherapy. Aquatic therapy promotes muscular development and coordination. With manual therapy, the joint will be gently mobilized within the range of motion and/or manipulations. Electrotherapy like transcutaneous electrical nerve stimulation reduces local musculoskeletal pain. If conservative therapy is not helpful, surgical repair of joints may be necessary at some time. Medication to decrease pain or manage cardiac, digestive, or other related conditions may be prescribed. To decrease bruising and improve wound healing, some patients have responded to ascorbic acid. Special precautions are often taken by medical care workers because of the sheer amount of complications that tend to arise in EDS patients. In vascular EDS, signs of chest or abdominal pain are to be considered trauma situations. In general, medical intervention is limited to symptomatic therapy. Prior to pregnancy, patients with EDS should have genetic counseling. Children with EDS should be provided with information about the disorder, so they can understand why contact sports and certain other physically stressful activities should be avoided. Children should be taught early on that demonstrating the unusual positions they can maintain due to loose joints should not be done, as this may cause early degeneration of the joints. Patients may find it hard to cope with the drawbacks of the disease. In this case, emotional support and behavioral and psychological therapy can be useful. Support groups are found to be immensely helpful for patients dealing with major lifestyle changes and poor health. Family members, teachers and friends should be provided with information about EDS so they can accept and assist the child as necessary. Despite all these different types of conservative therapy, except bracing, results show that conservative therapy is ineffective in contrast to midcarpal instability in normal patients. L. Rombort showed that in almost 40% of the cases, conservative therapy has a neutral or even a negative outcome. Thereby has to be noted that conservative therapy may be unsuccessful in controlling instability in the longer term. Surgery, the instability of joints, leading to luxations and joint pain, often require surgical intervention in patients with Ehlers Danlos syndrome. Instability of almost all joints can happen, but appear most often in the lower and upper extremities, with the wrist, fingers, shoulder, knee, hip, and ankle being most common. Common surgical procedures are joint debridement, tendon replacements, capsulorrhaphy and arthroplasty. Studies have shown that after surgery, degree of stabilization, pain reduction, and patient satisfaction can improve, but surgery does not guarantee an optimal result, and both patients and surgeons report being dissatisfied with the results. Consensus is that conservative treatment is more effective than surgery, particularly since patients with Ehlers Danlos syndrome have extra risks of surgical complications due to the disease. 3 basic surgical problems arise due to EDS. The strength of the tissues is decreased, which makes the tissue less suitable for surgery. The fragility of the blood vessels can cause problems during surgery. And wound healing is often delayed or incomplete. Studies have shown that local anesthetics, Arterial catheters and central venous catheters cause a higher risk in hematoma formation in patients with Ehlers Danlos syndrome. Ehlers Danlos patients also show a resistance to local anesthetics. Special recommendations for anesthesia in EDS patients are prepared by Orphan Anesthesia U and deal with all aspects of anesthesia for EDS patients. Surgery with Ehlers Danlos patients requires careful tissue handling and a longer immobilization afterwards. Prognosis: the outlook for individuals with EDS depends on the type of EDS with which they have been diagnosed. Symptoms vary in severity, even within one subtype, and the frequency of complications changes on an individual basis. Some individuals have negligible symptoms while others are severely restricted in their daily life. Extreme joint instability, chronic musculoskeletal pain, degenerative joint disease, frequent injuries, and spinal deformities may limit a person's mobility. Severe spinal deformities may affect breathing. In the case of extreme joint instability, dislocations may result from simple tasks such as rolling over in bed or turning a doorknob. Secondary conditions such as autonomic dysfunction or cardiovascular problems, occurring in any type, can affect prognosis and quality of life. Severe mobility-related disability is seen more often in hypermobility type than in classical type or vascular type. Although all types are potentially life-threatening, the majority of individuals will have a normal lifespan. However, those with blood vessel fragility have a high risk of fatal complications. Arterial rupture is the most common cause of sudden death in EDS. Spontaneous arterial rupture most often occurs in the second or third decade, but can occur at any time. The average life expectancy for vascular EDS is 48 years. EDS is a lifelong condition. Affected individuals may face social obstacles related to their disease on a daily basis. Some people with EDS have reported living with fears of significant and painful ruptures, their condition worsening, becoming unemployed due to physical and emotional burdens, and social stigmatization in general. Epidemiology: Ehlers Danlos syndrome is an inherited disorder estimated to occur in about 1 in 5,000 births worldwide. Initially, prevalence estimates ranged from 1 in 250,000 to 1 in 500,000 people, but these estimates were soon found to be vastly inaccurate as the disorder received further study and medical professionals became more adept at accurately diagnosing EDS. In fact, many experts now believe that Ehlers Danlos syndrome may be far more common than the currently accepted estimate due to the wide range of severities in which the disorder presents. However, the prevalence of the 6 types differs dramatically. The most commonly occurring type is the hypermobility type, followed by the classical type. The other types of Ehlers Danlos syndrome are very rare. For example, fewer than 10 infants and children with the dermatosparaxis type have been described worldwide. Ehlers Danlos affects both males and females of all racial and ethnic backgrounds, although some types are more common among certain groups than others. Society and culture: in the 19th century, there were several sideshow performers billed variously as the Elastic Skin Man, the India Rubber Man and Frog Boy. They included such well-known individuals as Felix Weil, James Morris and Avery Childs. Several current celebrities have EDS. Actress Shirley Houston has type 3 EDS and uses a wheelchair. She made history by becoming Coronation Street's first full-time disabled actress. The condition may have contributed to the virtuoso violinist Nicholas Paganini's skill, as he was able to play wider fingerings than the normal violinist. Eric the Midget, a member of Howard Stern's Whack Pack, has Ehlers Danlos syndrome type 7. Adult film star Mandy Morbid has discussed the impact EDS has on her mobility and her life. Ray Haycraft, lead singer for the hard rock band, Remy, artist, and illustrator of the novel The Last Judges. The condition is mentioned in the song Dorsal Horn Concerto by the British comedy band The Amateur Transplants. The condition has been mentioned in many television shows, including CSI New York in the first season episode, Blood, Sweat and Tears. FOX series Bones in the season 4 episode The Perfect Pieces in the Purple Pond. House in the episodes House's Head, and The Dig. the Law and Order episode Dignity. In the episode, a third trimester fetus is diagnosed with a condition and is slated for abortion. Shortly later, the doctor who is due to perform the abortion is murdered in church. USA Network series Royal Pains episode After the Fireworks. The subject of the season 7 premiere of the A&E series Intervention, Linda, claims to have EDS. The doctor's Cirque du Soleil Zoo episode. In this episode, the doctors discuss flexibility and EDS. In other animals, Ehlers Danlos-like syndromes have been shown to be hereditary in Himalayan cats, some domestic short-hair cats, and in certain breeds of cattle. It is seen as a sporadic condition in domestic dogs. Degenerative suspensory ligament desmitis is a similar condition seen in many breeds of horses. Though it was originally notated in the Peruvian Paso and thought to be a condition of overwork and older age, the disease is being recognized in all age groups and all activity levels. It has even been noted in newborn foals. The latest research has led to the renaming of the disease as equine systemic proteoglycan accumulation, after the possible systemic and hereditary components now being delineated by the University of Georgia. See also, abdominal aortic aneurysm, Arnold-Chiari malformation, joint dislocation, dural ectasia, dysautonomia, Gall-Ensign, hypermobility, Marfan syndrome, mitral valve prolapse, postural orthostatic tachycardia syndrome, subluxation, tethered spinal cord syndrome, tricuspid regurgitation, wrinkly skin syndrome. References. External links: Ehlers Danlos syndrome at DMOZ, Ehlers Danlos syndrome, classic type. Includes Ehlers Danlos syndrome type I, Ehlers Danlos syndrome type II, University of Washington Medicine, Orthopedics and Sports Medicine multi-page explanation of EDS, including symptoms, genetics, diagnosis, and treatment, National Institute of Health on Hypermobility EDS, Gene Reviews NIHUW entry on Ehlers Danlos syndrome type 4, eds at NIHUW Gene Tests, Ehlers Danlos National Foundation, Hypermobile A blog about Ehlers Danlos syndrome. The lack of clinical distinction between the hypermobility type of Ehlers Danlos syndrome and the joint hypermobility syndrome, management of pain and fatigue in the joint hypermobility syndrome, principles and proposal. For a multidisciplinary approach, anesthesia for EDS patients, guidelines at Orphan Anesthesia U.